Today marks the third day of stakeholders' engagement over the 4 bills to spearhead the implementation of the universal health care.
10 years of devolution.
Health Cabinet Secretary Susan Nakumicha met with the Council of Governors to discuss the bills which, if passed, will largely depend on the counties for implementation. However, even before the start of the meeting, the county governors raised what they termed as late consultation by the Ministry of Health on the bills which counties should have been co-drafters.
Are we recipients? Are we just part of public sector or what we call stakeholder engagements? Or are we supposed to be co-drafters of these particular bills?
The governors say that they were only consulted in drafting of the digital health bill, which will give powers to the cabinet secretary to be in charge of the health data, but were kept in the dark in drafting the social health insurance fund bill, the primary health care bill, and the facility improvement fund bill.
The failures of UHC has been because of lack of good legislation, good legal framework. Again, I don't want us to fail because of just simple things of consultation.
Your legal team and our legal team, which have not sat anywhere, should have sat and agreed on these issues before they go out to the stakeholders, unless we are being treated as stakeholders.
The concerns raised by the governors is the issue of the cabinet secretary owning all the data, which they propose that the county health data should be with the county. Another concern is the clause that seeks to make the national legislation prevail over the county legislation on the implementation of the Facility Improvement Fund Bill, which they say is unconstitutional. On the proposal to convert community health promoters into workers, the governor said that this will have serious financial implications and also feels underrepresented in the Social Health Insurance Board.
I'm seeing a standoff. If you give me a bill or an act to employ 1,695 workers who are CHPs, I cannot do it because of the resources. On your legislation, make it broad and a policy-based law that gives the room to the counties to be able to specify certain levies and fees that they may want to charge in public health related fees.
Concerns that the county says will be addressed before the final draft before the National Assembly. Technical teams drawn from the Ministry of Health and the Council of Governors have been tasked to iron out the outstanding issues before the lapse of the public participation expected to end by September 19th. Reporting for TAS TV in Thika, my name is Rachel Kamau.